everybody. This is Ivy, your physical therapist, doctor of physical therapy, and your certified lymphedema therapist. So hold on, let me just take a picture of this. This is the book that I published last year. I usually give this book to my new clients that is going to be under my care for lymphedema. So today I have a new patient that I'll be seeing. I'm just showing you guys this book, and I will talk about four or five of the frequently asked questions that I get when I see my clients for the first time. So let me turn the camera. Okay, there we go. I'm waiting for my next client. I'll be doing an assessment and first time evaluation for a lymphedema patient today. So I am going to share with you guys some of the frequently or most commonly asked questions that I get from my clients. So I have this on my book, this frequently or most commonly asked questions that I get from my clients in my book that I published. It's in chapter 10. So of course the most common one that I always get is, what is lymphedema? Why do I have this? Okay, so in my book I just give out like a little explanation for each of these questions. So what is lymphedema? Lymphedema is a medical condition where there is an abnormal swelling of the extremities, the trunk. The extremities could be your upper body, your lower body, and the trunk, the whole trunk, and other parts of the body due to the failure of our lymphatic system to eliminate lymph fluid into the circulation. In other words, there is an abnormal buildup of protein-rich fluid outside of the tissue cells of the body. So that's why we see these clients with swelling or edema, or their arms or their legs or their part of their body is bigger than the usual. It's not fat, okay? It's a different story when it comes to fat. So now there is another term that I usually get to be asked. It's the lipedema. 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 So what is this? Lipedema is a chronic condition that occurs most commonly in women. It is symmetrical presentation and it is painful. It is a fat buildup in combination of swelling in the lower body and with no affectation of the hands and feet. So you probably see this, like some people, they have their lower body bigger, like, you know, bigger than their upper body, and it doesn't look usually normal. So that is an accumulation of fat in the lower part of the body. That's called lipedema. Now sometimes there is what we call the lymphedema. It's a combination of the lymphatic fluid buildup plus the fat content of the body. And another question that I get that I usually get is what are the signs and symptoms? How would I know that I have this condition? So the most common signs and symptoms of lymphedema, it could be a feeling of heaviness or tightness in a particular part of your body, let's say in your arms or on your legs. And because it's so heavy and it's so swollen, there is restriction of range of motion. Like you cannot bend your knee, or you can bend your knee, but you know, you don't have the full range of motion. Sometimes you have pain because if it's so swollen or big, it will impinge or press on the nerve endings that causes the pain. And it is very, very uncomfortable feeling. It's you have discomfort. All right, so the next one is there is a recurring infections. Like in your legs, you see those people with swollen legs and they become red sometimes and sometimes not. So when it becomes red, there is already an recurring infection on the leg or the part of the body that has the lymphedema. There is thickening or fibrosis. So when you have the lymphedema, it's always like thickened and fibrotic. So that is why you have that is specific, more specific to your lymphedema clients. Okay, so those are the signs that you can see and some symptoms that you can feel when you have this condition. But it is always appropriate and necessary to have a proper medical care, proper medical attention. You gotta have to see your primary doctor, your heart doctor, or whichever doctor that is involved in your care, to make sure that you're getting the correct appropriate diagnosis and assessment so that you will get the proper treatment. Okay, now another common question is, why do I have this problem? What's the cause of my lymphedema? So there are secondary causes and there are primary causes. So secondary meaning it's caused by something that our body has been through, or has been done, or like there a procedure that has been done for our body. So most common secondary cause is surgery. So if you have, like, say, a tumor on somewhere on your breast area, if you have cancer of the breast and they have to remove the cancerous tumor or cells, and sometimes sometimes the surgeon will remove your lymph node. So then from that you will get lymphedema, because the lymph node is part of the lymphatic system. So then once the doctor remove your lymph node, eventually you will have lymphedema on your arm. Another common cause is radiation treatment. After you have been diagnosed with cancer and they do radiation on a particular part of your body, and the radiation affects the lymphatic system, those tiny lymphatics and the bigger lymphatics, that causes the area to have swelling or edema. And if there's an infection of the lymph node, or infection caused by parasites. So an infection caused by parasites, there's one very common medical condition that is being paired to, or that's being it's called elephantiasis. It's called filariasis. It's from a parasite somewhere in the tropical area that gets into your skin, and it causes your skin to get your lymphatic system to be infected. And with that parasite, which is called filariasis, it causes your part of your body to get swollen because of the lymphedema, because of the affectation they did, or the damage or the injury to the lymphatic system caused by the parasite. So those are some of the common causes of lymphedema, and those are some of the common questions. So in the next video, I will try to answer some of the other questions that I get. But if you want to get hold of my book, it's a very simplified book, and everybody can understand it. It's easy. I wrote this book primarily for my clients, for my lymphedema patients, to understand better of what they are having, or what they have, and how they can, how they can handle it and take care of themselves despite having this condition. And the title of the book is Lymphedema Warriors, Health and Wellness. And in here there is the complete decongestive therapy, exercises, and some part of nutrition and diet. So you can get this through Amazon, and you can also get this through Barnes and Nobles. All right, I hope you got something from this quick video that I'm making before I will get into my client's house and see what I can help her with, making her condition better, or making her quality of life better. And if you like this video, and if you want to hear more about lymphedema and other physical therapy issues and conditions, what we can do to help out, I will be posting videos in the future, probably mostly about lymphedema and physical therapy clients' condition that I get to work with. And if you like this video, I would like you to share this, like, and subscribe if you want. I also post videos regarding my plants. I love plants, so I do that. And of course, the personal family finance, I do that too. I'm trying to do as much as I can. So I would like to share whatever I have learned. So once again, it's Ivy, your physical therapist, your doctor of physical therapy, and a certified lymphedema therapist. Thank you for watching, and now I'm ready to go see my patient. Bye!